Sariki made the disclosure at the commemoration of 2017 World AIDS Day in Abuja. Scanning electromicrograph of an HIV-infected T-cell. Sariki made the disclosure at the commemoration of 2017 World AIDS Day in Abuja. Represented at the occasion by Sen. Mawabunwe, Senate Committee Chairman on Primary Health Care and Infectious Diseases, Sariki said that the act was signed into law by former President Goodluck Jonathan. He said it stipulates that 1% of consolidated fund be set aside for health care provision. He, however, added that the implementation of that part of the act was not included in the proposed 2018 budget recently submitted by President Muhammadu Buhari to the Senate for consideration and approval. The Senate President said correction to the budget by the upper chamber should not be misconstrued as budget padding. He added that the Senate was ready to synergize with the executive arm of government in ensuring proper funding of health care in 2018. We have resolved as a parliament that in 2018, we will implement the National Health Act 2014, which states that 1% of consolidated revenue fund should go to the establishment of basic health funds. This will enable us fund all our health services, including HIV and AIDS, he said. He added that the immediate implementation of the act, especially the clause on provision of basic health care funds, was necessary, if the country would take ownership of the HIV and AIDS funding. He advocated adequate financing of HIV and AIDS programs by government at all levels. Sariki said that Nigeria was a signatory to the Abuja Declaration, where African countries agreed to commit not less than 15% of the national budget to health. He called for adequate government support for local manufacturing of vaccines, antigens, and other drugs for the treatment of HIV and AIDS. In his remark, President Muhammadu Buhari had reaffirmed the commitment of government to universal coverage. The President, who was represented by Mr. Boss Mustafa, the Secretary to the Government of the Federation, said federal government appreciated the achievements and challenges related to the fight against the spread of HIV and AIDS. He said, "I assure you all that my government will give adequate attention to the effective implementation of policies that will promote sustainable development in Nigeria. Our commitment to universal health coverage for all Nigerians aligns with the African Union's road map on shared responsibility and global solidarity to address HIV and AIDS, malaria, and tuberculosis in an integrated manner. In this vein, we are committed to the African Union goal to end AIDS and other infectious diseases by 2030. Prof. Isaac Adwole, the Minister of Health, said, "No one should be denied the right to health. HIV care, prevention, and treatment services are fundamental human rights. In order to scale up HIV and AIDS services over long term, significant financial and human resources must be mobilized. The strategies to be deployed included increased resource mobilization and improved inefficiencies in service delivery," Adwole said. He said government was working hard to revise the trend and approach to the National HIV Response Program.